Hello, my name is Joseph Greenwell. My pronouns are he, him, and his, and I have the wonderful opportunity to serve as the Vice President for Student Affairs here in the Office of University Life at Columbia University. I'd like to thank you, everyone, for being here for this important conversation. You may ask, who is University Life? Well, we are a student hub for you. We provide information, resources, events, and initiatives that support the university values of inclusion and belonging, health and well-being, sexual respect, and community citizenship. Please get involved with us. Email us at universitylife@columbia.edu or follow us on social media. So we have a great conversation planned for today. And I just want to acknowledge that COVID-19, conversations around COVID-19, it doesn't always necessarily inspire a sense of excitement. We talk a lot about it, but we also want to acknowledge it's complex and it requires sustained courage, curiosity, and commitment. By showing up today, you're helping to do your part to educate yourself and also to help our community. So thank you for being here today. I hope you also are feeling a sense of excitement, though, as things continue, the landscape changes, and as we are starting to plan for the return to our campuses. I know I am in getting excited in this moment of time. While you'll be hearing about one element of our return today, namely how we'll be reopening safely through vaccines and other key measures that are needed to combat the pandemic, the health and safety piece is just one element of the incredible planning that is underway right now at the university to ensure a positive return. So more to come in future weeks on the other initiatives that are happening. So we have two goals today in our conversation. The first is to share critical need-to-know information with you. And the second is to create space so that you can get your questions answered as well. We'll meet these goals by sharing actionable, updated, evidence-based information with the larger aim of keeping each of you, and by extension, our larger community, safe and well. Turning to our program for today, our thanks again to all of you for joining us and to many of you who had already submitted questions in advance. If you have additional questions during the seminar, please use the Q&A chat feature at the button if you're in the Zoom webinar. And if you're following us by live stream, you can also email us at universitylife@columbia.edu, and we will be sharing those with our panelists. So I'll moderate the first part of our conversation, and then it will be immediately followed by the Q&A segment. I also want to pause just for a moment and to acknowledge that today falls during the holiday of Eid al-Fitr, which is a Muslim holiday, and so members of the community at Columbia may be unable to join us as a result. I also want to share, though, that we will be video this presentation, and it will be live on our website in the coming days so that anyone who is unable to attend will be able to get the same information as well. We are so fortunate to have an incredible panel today, and I'm humbled to be part of it, to be honest with you. And I'll be providing brief introductions so that we can save time for the conversation, but I encourage you to read their full bios online and their contributions, not only to Columbia, but far beyond. So I'd like to start with Wafaa El-Sadr, who is Professor of Epidemiology and Medicine. She is also the Director of the Global Health Initiative at the Mailman School of Public Health. Dr. El-Sadr is a university professor of Epidemiology and Medicine, the Director of ICAP, and Director of the Global Health Initiative at the Mailman School of Public Health, as well as the Director of Columbia World Projects. Donna Lynne is the Senior Vice President and Chief Operating Officer of Columbia University Irvine Medical Center and the CEO of Columbia Doctors, which is an 1,800-member faculty practice. She also serves as the university's COVID director. Melanie Bernitz is the Senior Vice President for Columbia Health, who joined Columbia Health in 2016 and served as Associate Vice President and Medical Director through early 2021. She is also Associate Clinical Professor of Medicine in the Center of Family and Community Medicine. Julie Kornfeld is Vice Provost for Academic Programs and Associate Professor of Epidemiology at the Mailman School of Public Health. As Vice Provost, Dr. Kornfeld oversees the university's broad range of academic programs with a focus on compliance, policy, and regulatory requirements. So without further ado, I'd like to open the conversation by calling on Dr. El-Sadr to give us an overview and update on vaccine approval, availability, and distribution worldwide.
Thank you very much, Joseph, and very much appreciate the opportunity to be with you all today. And I'm going to share screen. Okay, so let me get started, and I'll provide a very brief COVID-19 update as well as an update on vaccines and where we're at locally and globally. So first, what's the status of the global pandemic? And I think all of you are likely aware that we continue to have ongoing new cases of COVID-19 around the world. Now, more than 160 million confirmed cases have been reported, and more than 3.3 million reported deaths have also been reported. The good news is that globally, there have been more than 1.3 billion doses of vaccine that have been administered thus far, and that's really good news. Now, in terms of the regions that have contributed the largest numbers of cases of COVID-19, it's been from the Americas, North and South America, 40% of the cases, and 34% of all the cases reported thus far from Europe, and you can see the contributions from other regions of the world. You will see that currently the top 5 reporting countries have been led by the United States, followed by India, and as you're well aware, there's now alarming rates of COVID-19 cases in India, followed by Brazil, France, and Turkey. Now let's talk about where COVID-19 is at in the United States. And as you can see here from this on the left-hand side, is that in the United States there have been more than 32 million cases, confirmed cases that have been reported. And this represents 1/5 or 20% of global cases, while the US population only represents 4% of the global population. And more than 583,000 confirmed deaths have been reported in the United States. The good news is, you look here on the upper right-hand corner in this figure, you can see that after this last surge that we experienced in the United States over the winter holidays, we're now thankfully experiencing a drop in the numbers of daily cases of COVID-19, now averaging between 30 to 40,000 new cases per day. In New York City, a city that has also borne the brunt of this pandemic, there have been more than 939,000 reported cases of COVID and more than 32,000 reported deaths. And as you can see here in this figure on the lower right-hand corner, is again, New York City experienced the same surge that the US experienced over the winter holidays, but also really good news is that we're experiencing now a substantial decrease in the total numbers of cases that are reported on a daily basis now to less than 1,000 cases per day. So let's move on to vaccines. The good news is that we've had a very robust pipeline of vaccines. And you can see in this figure that there are a total of 49 different vaccine candidates that are in development, undergoing very early phase of research to determine their safety. And then even in the phase 3 studies, which are the very large studies that are done to determine whether a vaccine candidate is safe and effective, we have 27 candidates that are in research at this point in time. And you can see the large numbers of vaccines that have been authorized or have been approved already. So this is really good news. Now, in terms of in the US, as you're well aware, there are now 3 vaccines that have been authorized for use, for emergency use, authorization by the Food and Drug Administration, and recommended for use in the US by the CDC. And these include the 2 mRNA vaccines, the Pfizer-BioNTech vaccine, the Moderna vaccines, and then the Johnson & Johnson Janssen vaccine, which uses a very different technology to produce the vaccine. And the good news is that across the board, these vaccines are all efficacious, and the FDA determined that any vaccine that shows more than 50% efficacy is considered to be efficacious, to be effective. And this the Johnson-Janssen vaccine was 72% efficacious in the United States, and 95% and 94.5% for Moderna. I caution everybody not to compare these effectiveness numbers across these different vaccines, because these studies were done at very different times, in different contexts, in different pandemic contexts, and therefore it can be misleading to compare the effectiveness across these different vaccines. They have not been compared head to head to determine how they compare to each other. The other good news is that all of these vaccines have been found to have mild to moderate side effects, and no severe side effects have been noted, and I'll talk about one specific rare side effect. And most of the side effects have been local at the site of the injection, and sometimes with some systemic symptoms like headache or fatigue or fever that goes away after a few days. One distinctive feature of the Johnson & Johnson vaccine is that it requires one dose versus the other two vaccines, which require 2 doses, day 1 and day 21 for Pfizer vaccine, and day 1, day 28 for the Moderna vaccine. I want to point out that a rare side effect has been reported with the Johnson & Johnson Janssen vaccine of a blood clotting side effect associated with very low platelet count. It's a rare side effect that has been reported to occur largely amongst women, and largely amongst women less than 50 years of age. However, based on a very careful assessment that was done by the CDC, by experts at the CDC, it was determined that this side effect is rare. About 7 individuals experience this rare side effect amongst a million vaccinations. And also weighing the benefits versus the risks of this side effect, the CDC recommended that the benefits of this use of this vaccine far exceed the risk of developing COVID-19 itself and its complications. In addition to the 3 vaccines here that have been authorized in the United States, there have also been 2 other vaccines that have received authorization by the World Health Organization, WHO, and these include the AstraZeneca vaccine and the Sinopharm vaccines. Now, the good news is also the scale up with vaccination has been ongoing, and focusing here in this slide on the United States, and you can see that here in the figure the rapid increase in the numbers of doses administered by day over the last several months, although we're observing now is slowing and plateauing in terms of the numbers of vaccinations administered per day. And that should be of concern and requires active promotion of vaccination and trying to overcome the logistical difficulties of getting vaccine, as well as some vaccine hesitancy. And you can see that overall in the United States now, 35% of have received individuals have been fully vaccinated. And you can see in this map that there's great variability in terms of vaccination, and this is the percent of all residents within the specific states here who've received at least 1 dose of the vaccines, and that can be as high as 50% in the darkest green versus other parts of the country where a much lower percent of the population has received vaccination. In terms of New York City has done well as well over the past several months, and you can see here the daily numbers of doses administered in New York City. But similarly in New York City, we can see the decrease in the numbers of daily doses administered in New York City. And this requires a redoubling of efforts to, again, try to reach individuals as quickly as possible and make it easy for them to get vaccinated. And again, engage those who may be hesitant to get them to the point where they seek vaccination. In New York City, we can see that actually when you look at the population in the city, and overall 46% have received at least 1 dose and 37% have been fully vaccinated. There are some demographic variabilities in terms of vaccine coverage, and you can see here, for example, looking at by borough, that a larger proportion have been vaccinated in Manhattan. Also, a larger proportion of older individuals have been vaccinated versus younger individuals, and also amongst females versus males, and also by race ethnicity, with a higher proportion of Asian individuals and white individuals having been vaccinated compared to amongst Latinx populations and Black African Americans. So we're seeing both geographic as well as also some demographic disparities in terms of vaccination coverage. And globally, we're seeing similarly also, not just that these disparities exist within countries, like I showed you in the US, but there also are enormous disparities in terms of vaccination coverage across different countries. And here, again, the numbers of doses administered per 100 persons, and in the darkest green, you can see some countries that have done extremely well, but you can see also other regions of the world where there's barely any vaccination uptake. Very quickly, I'm going to tell you some nice data, reassuring data. These are, for example, data that show that 6 months after getting a Moderna vaccine, there's persistence of these protective antibodies against various strains of the virus of COVID-19. And also, these are data regarding the Pfizer BioNTech vaccine that show that 6 months, when they assessed this as 6 months, it was shown that very high efficacy, 91.3% effectiveness at 6 months after vaccination. So these are really good news that tell us that these vaccines, at least thus far, have been shown to have a durable protection. And then there's real life experience with use of the Pfizer BioNTech vaccine. And this is coming largely from studies that have been done in Israel that demonstrate, again, you can see more than 90% protection against symptomatic, asymptomatic COVID-19, hospitalizations with COVID-19, severe illness, as well as death from COVID-19. So very quickly, the COVID-19 vaccines offer clear individual as well as public health benefits, particularly in preventing symptomatic illness, but now we have evidence of preventing even infections that are asymptomatic. And also the vaccines that are authorized in the United States have favorable vaccine profiles, with most of the reported side effects have been mild to moderate. There are great gaps that exist in vaccination coverage within countries and across countries. The really encouraging data that continue to be reported from various parts of the world that demonstrate that these vaccines work in terms of controlling and preventing COVID-19. And this rare side effect that has been noted with the Johnson & Johnson vaccine should be acknowledged. However, the risks have been shown to be much lower than the risk of getting COVID-19 or its complications. And lastly, of course, want to end by stating that Columbia is committed to ensuring that all affiliates have access to COVID-19 vaccines and fulfilling the mandate of the student vaccination for the fall semester. I'll stop here and thank you very much and hand it back to you, Joseph.
Thank you so much, Dr. El-Sadr. It's so helpful to zoom out and get the global perspective as we're planning here locally in our own community, given the global complexities of COVID-19. And now I'd like to turn to Dr. Lynne and to invite you to share key updates on vaccine availability in New York for Columbia faculty, staff, and students, and also speak to what is being considered in terms of university policy for the fall.
All right, great. And fortunately, I'm going to really truncate my remarks because I know there's a lot of questions and we don't have a ton of time. And Wafaa covered a few of the items that I wanted to touch on. And so I'm going to really focus on the vaccine. And you saw Wafaa's depiction of what happened in the US. This is a depiction of what happened in New York State, not New York City. And it's a slightly different curve, but nevertheless, the most important part of this chart is this very, very steep decline that started in April to levels that New York City, we're almost back to where we were in November, which, as you can see from this, this graph, that we had a long, long period of time where we were within 1 to 2% positivity. I always like to show the map. In the map, if I had shown you this map even a month ago, it would have looked strikingly different. Dark is not good, light is good. Manhattan has been a very, very safe place, but what's so encouraging to see is that we are seeing much more light areas across the entire city. And in fact, the New York State rate of positivity as of yesterday is 1.28%. So in a very, very comfortable range. And even New York City has now dropped below 2%. So these are numbers, as I said, that we haven't seen since November. So let me just focus on a couple of things on vaccines. And you saw some of the data from Wafaa. I mean, the speed with which vaccines have been administered should be encouraging for students, no matter where you come from. Clearly, there are variations across the states. New York State happens to be, though, it wasn't always one of the leading states when it comes to vaccine administration, with 61% of New Yorkers having done at least one dose and 50% having completed the vaccine series. That's based on the eligible population. And one of the things that you probably realize, and we actually started today, is that beginning today, we have a whole new cohort of eligibles. These are 12 to 15-year-olds. Previously, we had been doing 16 and 17-year-olds, but it was exciting today to start with some of those who are younger. One of the things that Columbia has been doing all along is that we have been working with New York Presbyterian Hospital since December 15th to provide vaccines to faculty and staff at the Armory here on 168th Street, which is where I sit. But we also opened up our own locations in the Black Building at CUIMC and at several Columbia Doctors locations, 2 in Manhattan on 103rd and 1 on 51st Street, one at 15 North Broadway in White Plains, and very importantly at Lerner Hall on the Morningside campus. So we are doing, as I said, vaccine administration for children in all of those locations, with the exception of Lerner Hall. And Columbia affiliates and their family members, their friends, anybody can make an appointment and get vaccinated. And as you heard, at absolutely no cost. Wafaa showed you the chart, and I think it's important to just look at the New York profile. As I said, one of the better performing states, not as high as Vermont. I think Vermont is in the mid 70% and one of the leading states. So the last two things I really want to talk about is what we are doing and then what the student mandate is all about. I know there were a lot of questions about that. So as I mentioned, we've been doing vaccines. Our own faculty staff have been volunteers at these locations, and in some cases, students who were eligible, graduate students in particular, have also been volunteering literally for now 6 months. We have been using all 3 vaccines in our locations. Most prevalent has been Pfizer, but in some cases we've used Moderna and we've used J&J. We want to provide J&J where we can, particularly for students who might be leaving the campus in the last several weeks. When we started doing this, it was hard to get appointments. Appointments would disappear in 15 or 20 minutes when we put them online. It's no longer an issue, and we are trying to accommodate. We often get family members who come with one who has an appointment, and I know both at Lerner and at the other Columbia Doctors locations, we're taking a lot of folks. We prefer that you make an appointment because we have some complicated issues with respect to the vaccine. But we really are trying to accommodate everybody, and we'll continue to do that into the fall as you see the mandate that I'm going to talk about. The important things about the mandate right now is that it does apply for all undergraduate and graduate students. We do need students to not only get the vaccine, but to get it in a timely fashion. We don't want anybody to wait. So if you are not on campus right now and you're in another state or even in another country, we really urge you to get the vaccine in those locations. We will accept, in fulfilling the mandate, documentation that comes from another state, another country. The United States documentation is a standard CDC card, excuse me. And we will be providing all of that information to be able to both record that information and to apply for medical and religious exemptions where those are required. Last thing, just want to mention, before you come back to campus, don't wait till the end. As I said, get it where you can, but certainly no later than 14 days prior to coming back to campus. Excuse me. And international students, we will accept those that have been World Health Organization approved, and continue to watch that. There are links on our website so that you can check, because it is evolving over time. And the last thing that we've been working with and struggling with a little bit is the fact that first and second doses were often matched, actually. We now have something called universal dosing. And so in some cases, our students got a vaccine in one location. We would say, we can't give that to you because the supply was matched, and that was a federal requirement. We no longer have that. But again, try to get vaccinated as soon as you can as we prepare for return to campus. So I'll stop, and I'm going to turn it to Melanie, who I think is also going to share with you some of our other distancing, face covering, and other safety measures that we have in place, as well as some late breaking news that has come out of the CDC.
Thank you, Donna. Hopefully you can see my slides now. Good afternoon, everyone. And I am going to, kind of get into some even more granular detail about some of the things you've heard so far, and hopefully answer some of the questions that are coming up in the chat. Just to come down to our campus level, because you've seen the global, the national, the New York City data, our campus picture is actually even better than the New York City situation that Donna just described. Since June, we've done over 240,000 tests across our campuses, and our cumulative positivity rate is only 0.37%. We also every week do some random surveillance testing of everyone who's accessed campus. We take a random population, and this gives us the true prevalence estimate. And you can see that last week that positivity rate was 0 amongst that group. It has never gone above 0.37% in that group, so well below the New York City ranges, and that should be a very reassuring indicator. It really shows us how strongly and how safe our campuses are. We continue to track not only the positive cases that we get through our testing, but also if our affiliates test positive outside of the university. We have a contact tracing team that responds rapidly, and that rapid response has further limited and prevented any transmission. I always like to emphasize, for those of you who haven't been on any of our forums before, that we have a website dedicated to all things COVID. That web address is covid19.columbia.edu. You should bookmark that site, check back frequently. We real-time update that site. We add FAQs based on what comes up in these forums. So really, you may actually be able to find answers to your questions. They have a chat bot there, so you can type in your questions and get real-time updates. covid19.columbia.edu. Just to kind of share, because I see questions about, what's Columbia doing about the new CDC guidance that just came out about an hour before this forum. Over a year ago, we set up a process so we could really iteratively review the guidance as it comes out from the global, the national, the state, and the local levels, and how it impacts our campus. And we have teams of people who are looking at these guidelines and recommendations and requirements and using all of them put together to inform our campus response. So the CDC does recommend broad national guidance, and that just happened. I'll speak about that momentarily. That is then subject to local guidance, because the university is subject to state and local laws, such as Department of Health guidance from New York State and New York City. So we have to wait for those entities to review the data. And then in our public health and other working groups, we monitor that further, see how it aligns with current trends, such as positivity rate, hospitalizations, and death rates, as well as campus rates, and then see if it aligns with university policy, and then decisions are made to adopt it. It's also important to emphasize that a key tenet of our policy has been to ensure equity across our campuses and across our student populations. So even if some areas have a higher vaccination rate, we ensure that our policy considers the entire community. And this has been a really successful approach, one we continue to use. I think, as we look back on the last 15 months, this kind of iterative process and policy adoption has allowed us to avoid having to shelter in place. We haven't had to do a quarantine in place order for any of our populations in the past year. We've kept our labs open. We've had a very safe environment. So in answer to some of the questions that are coming up around the CDC guidance for fully vaccinated and masking, that guidance just came out today. We will go through this process in terms of, we will see where New York State falls in terms of whether or not they adopt that guidance. We will be reviewing it through our public health experts and then seeing how it fits in with broader university policy. And then we will post on the website as well as in communications if there are any changes. So as of today, based on that guidance, we don't make immediate changes. We go through this process. So just a quick reminder, our community's become very familiar with daily routines when coming to campus. What these will look like in the fall, it's a little too early to tell if these will be the same or if there will be adjustments to them. But I think the important thing is, you're hearing all along, get vaccinated as soon as you're able, wherever you're located. For now, in the situations where you're required to wear a mask, stay home if you're sick. And this has really become part of our shared responsibility for community health. As I mentioned, we're continuing to review these and adapt these as the situation changes. And certainly for those of you coming back in the fall, we'll be sure to communicate what the daily routines will need to look like. We do have a daily attestation right now. Again, it's become as familiar to many of us as brushing our teeth in the morning. And we do adjust these. So we've changed the questions based on the requirements that we have from the Department of Health. And this is a required piece. This isn't just a university decision. We have to have a daily screening mechanism. It is still in place. It looks at symptoms, at positive testings and close contacts. And this is a system that we have also used to allow access to campus with the green pass and the red pass. Again, how this will look in the fall will be updated depending on what the requirements are. And it's likely this is where the vaccine requirement will live as well. So more on the vaccine plan. As Wafaa and Donna explained, the vaccines are safe, they're effective, they're backed by science, and we continue to encourage our students to get vaccinated as soon as you are able, wherever you are able. For our domestic students who are in the United States, every state across the US has access to vaccines now, so don't wait. A lot of questions have come up about younger adults and whether or not they need to get vaccinated because they maybe don't get as sick. Well, they are actually now the largest group getting infected with new infections of COVID-19. They're representing a larger proportion of hospitalizations due to COVID. So remember, getting vaccinated not only protects you individually, but it protects your family, your friends, and the broader community. So please do get your vaccine as soon as you're able. So a little more detail on how the vaccine requirement works. As Donna shared, all students are required to be vaccinated for the fall term. Both the COVID-19 website as well as the Columbia Health website contains answers to many of the FAQs, including the reasoning behind the requirement and how to comply. You should have hopefully received an email from me earlier this week if you're a Morningside student explaining the requirement with instructions on how to comply. And again, this applies regardless of why you're coming to campus or for how long. It's really for any participation in any in-person activity. And again, anyone who fails to comply or has not received a medical or religious exemption won't be permitted access to university facilities. So how do you complete this requirement? As Donna mentioned, the expectation is that you will comply with this at least 14 days prior to arriving on campus. And that 14 days is because it takes 14 days after you complete a course of vaccine to ensure you are fully vaccinated. This is very possible, as we've mentioned, for all domestic students living in the United States, as there is widespread vaccine availability currently, and you have ample time to complete this requirement. So this is why we're sharing this messaging with you so early. But we do understand for many of our international students, this may not be possible, given that you may have limited access to vaccines in your home country. Please be assured that we will be providing vaccination when you arrive on campus if you haven't been able to access a vaccine to help you expedite this process. You will be required when you arrive to follow whatever the New York State required quarantine is at the time. As Donna mentioned, right now there is no required quarantine, but that may change. And we will certainly share what other precautionary measures need to be taken when you arrive, such as testing if you're not vaccinated. But we're not going to block your access to your housing if you have not been able to get vaccinated in your home country. Again, to reinforce, we will accept any vaccine that is either FDA approved, so the 3 currently authorized vaccines in the United States, or any vaccine on the World Health Organization emergency use list. This list is updated frequently, so please check back to see if the vaccine you have received is acceptable. Again, you're fully vaccinated at least 14 days after the second dose of a 2-dose vaccine, or 14 days after a single-dose vaccine, currently only the Janssen J&J vaccine. And in order to meet the requirement, please submit your documentation via the Secure Columbia Health Patient Portal. If you're a Morningside student, if you're a CUIMC student, next week you'll receive information on how to submit your documentation. The instructions on how to do this are on the Columbia Health Immunization page, as well as when you log into the portal, you can download the instructions there in terms of uploading photographs and entering dates. Just a little bit more on the medical and religious exemptions. We do understand that there may be needs for these exemptions, and for those wishing to request these, please submit the required forms in advance of the fall semester, again through the same portals. Even if you have an approved exemption for another vaccine, you must submit a new request for the COVID-19 vaccine. We'll consider all requests, but approval is not guaranteed, and you will receive a determination letter. And I must emphasize that this is only for medical and religious exemption requests. We do not review personal or philosophical exemptions to the vaccine, because this is a university requirement. We're getting a lot of questions on testing. We have evaluated our COVID-19 testing approach throughout the last year as the situation evolved. It's been pretty flexible and adaptable based on the situations we've seen on campus in New York City. And we've had 2 large-scale high throughput testing centers, one on each campus, to accommodate this. So the fall 2021 testing program is not yet fully defined, because it's a little far in advance to do so. There may be a gateway or re-entry testing for those who are new to campus at the start of the fall term. More guidance will come regarding the period of time during which this test will be completed and how to do that. And then it will be followed by some element of ongoing surveillance testing, because this surveillance program has really helped us monitor campus prevalence of COVID-19 and adjust our other public health protocols. But again, the exact details of this surveillance are still being determined based on the vaccine requirements, and will be published in advance of the fall term regarding how often testing needs to happen. Finally, I just always want to remind everyone about the extensive resources that are available for our student community, both on the Morningside and the CUIMC campuses. So remember, many services are available in person, but we are all having multiple services available virtually, including medical and counseling services, as well as health promotion, disability, sexual violence response. There are a lot of offerings, so please be sure to go to the appropriate website so you can see what's available to you, not only in the fall term when you return to campus, but right now as well. So hopefully that's helped answer some of the questions. I'll stop my share. I'll turn back to Joseph.
Great. Thank you so much, Melanie, Dr. Bernitz, sorry. I know this is like an ever-changing landscape, and the information you provided is so helpful. And I just want to reiterate to people to keep looking on the COVID-19 website on the university as information continues to change and adapt. And finally, I'd like to invite Dr. Kornfeld to discuss academic implications and plans for reopening.
Thank you, Joseph. We last, but hopefully not least. So I think what I'm just going to spend a few minutes talking about is our return to campus. I know that most of you read the announcement from President Bollinger when he announced in March our plans to return to in-person academic activities. And this includes plans for teaching to take place in our classrooms, and for undergraduates to be housed in our residence halls, and for research and service work to resume. Since that announcement, there has been active planning all across the university to ensure that we return to campus and that we resume as much in-person experiences as possible. It's an exciting time for all of us to plan to be together again on campus and return to the robust intellectual, academic, and social life we have all missed so much. There are really big 2 critical variables that are critical to our safe return to campus. One is mandatory vaccination. And I think you've heard quite a bit about that. As has already been stated, our students will be required to be vaccinated. The second variable is distancing in the classroom. And as Melanie and others have mentioned, we continually await guidance from the CDC and from New York State. We also regularly monitor the public health situation. And as we wait for those, there still remains some questions about what will be allowed in the classroom. We are actively planning for multiple scenarios to maximize our ability to have in-person instruction. And we believe that likely the 6-foot and even the 3-foot guidelines will not persist by the time we get to September, but it's too soon to know that. So we will certainly be updating all of you, and this has implications for how much in-person classrooms we can offer. But I want to be clear that our expectation is that all students enrolled in Columbia University will return to New York City in the fall. There will be an accommodation process for students who are unable to return for health reasons or for reasons that might be related to their visas and their international ability, as international students, their ability to get visas. But we expect this to be a small number as appointments are opening up across the world, and guidelines and instructions for exactly what needs to be done for that accommodation process will be forthcoming. And these are different guidelines than for vaccine exemption, to be clear. Depending on the school and program and the availability of classrooms and the state guidance that I mentioned, it's possible that some programs will need to continue to offer hybrid or online classes. So it's possible if classroom spaces and we have limitations in density that some classes might be, for example, in person 1 week, and then another cohort will be online in a different week. But all schools will provide in-person instruction and expect their students to return. So I want to also just to continue to support the planning that's gone on. To support that return, we have developed space utilization guidelines for all schools. So we are safeguarding all university spaces to be prioritized for instruction use and to support student life. And research activity is also a priority. And finally, the campus, as I think Melanie stated very clearly, is that the campus is safe. Our most recent positivity rate is very low. We fully expect that rate to continue with the safety protocols and the testing plans in place and the vaccination plans. So I think the outlook is very positive. We're excited to see you all in person here in September. And I'll stop there because I know there are many, many questions, and return to you, Joseph.
Great. Thank you so much, Julie, for that information. Much appreciated. So we have gotten a number of questions. I'll just, some of them are categorical. So I'll start with, there are a number of questions about individuals who either got a different vaccine from their home country and then coming back and that vaccine not being recognized and getting another vaccine. And what does that mean? And are there any health implications? And there's also a number of questions talking about what happens if they got one shot in one location, but not able to get their second. And then what happens when they come here to Columbia?
I can start with that if I can remember all the various parts of it. So we will accept vaccines that are on the World Health Organization emergency use list. And as I said, that list is changing. So you may have gotten a vaccine that's not currently on the list, but check because the list shows what they are reviewing and it may be accepted. However, if you end up having had a vaccine that is not on that list, the CDC does recommend revaccination. And the only caveat is that it should be at least 28 days after you had a different vaccination. So we'll certainly work with you on those situations regarding revaccination if necessary. Similarly, if you've had one dose of a vaccine that we just don't have available in the United States or isn't authorized, the same thing applies. Wait 28 days, we'll then give you a full course of a US vaccine. So if it's a 2-dose series, you will still get the 2 doses in the United States to be considered fully vaccinated. And then the last piece is what Donna explained. If you got a Pfizer or a Moderna vaccine somewhere else and have been unable to get the second dose, we now are able to give you that second dose because we don't have the same constraints in terms of the matching of doses.
I think I would, as I think both Donna and Melanie mentioned, I think what we're recommending is individuals to get vaccinated as soon as possible and let us then, and just before, as soon as you can, and then bring documentation of this vaccination. And then we'll take a look at this and determine whether it's one of the authorized vaccines or not, and the doses and so on. But that's the most important thing, is to get fully vaccinated as soon as possible. And then we can do the determination afterwards.
Great. Thank you. There's also, I think, And I think some of these questions are just reiterating something that you shared, Melanie. And so regarding if they get their vaccine here, if they're able to move into the residence halls immediately, are they able to attend class and engage with the community? What to expect in that space?
Yeah. So I think this is where there's kind of potentially a division. Domestic students should be able to comply with this mandate well before move-in because vaccines are available. So there's really, I think that there's a different line drawn there. For our international students, if you've made your best effort and it's either not available in your country or is not an authorized vaccine, we're going to help you expedite vaccination when you get here. We've got adequate vaccine, but we understand that you may not be fully vaccinated before you move in. We wouldn't be blocking access to residents, but there will be different precautions that need to be taken. It may be more frequent testing until you're fully vaccinated. If there are differences in mask rules or guidelines for the vaccinated and unvaccinated, you may fall into a different category. So I think there's a lot of information that will be coming, but rest assured, we're going to help our international students get vaccinated if they've been unable to do so, and help them be able to move in and have access. We don't expect you to arrive 5 weeks before, unless you want to avoid those other precautions in order to meet this requirement.
Thank you. I'll turn to Julie maybe a little bit and not have you be last this time, Julie, but to ask the questions regarding, there's some around academics. What can students expect? Will classes be hybrid? Will they be in person? What are some things that are being discussed?
Yeah, and I think, as I said, Joseph, all of the schools are planning to have as many in-person classes opportunities as possible. And that is everybody's goal. I think, again, as we wait for additional guidance around classroom density, and it's a little early still if we're waiting to return to campus in September to know exactly what the state may provide, but we're optimistic that those guidelines are going to be less and less in terms of the 6 foot and even the 3 feet, and that we will have many, many more opportunities to be in person. So students should expect to be in person as much as possible. Your schools will be in contact with you directly about your specific program, because there is some variability in terms of number of classrooms available and access to those classrooms. It's a little bit different on the medical campus, for example, than it is on the Morningside campus. And so in order to accommodate some of the large classes, if there are continue to be some distancing requirements, there will be some hybrid elements to those classes. But again, everybody's really trying to plan for in-person. Wafaa, did you want to add?
Could I just maybe add? Today's news is a game changer for us. Yeah. So I do think that while we have some work to do to analyze and think about it, it is. I would even more strongly say that we're the overwhelming majority of classes will be in person. The combination of the mandate, vaccine mandate, and the fact that the CDC has relaxed even indoor face coverings, with potentially some exceptions. They did, we do have clinical classes where we have to evaluate what the impact might be, but I think this is clearly the most significant change I think that we've had in the last 14 months, and it allows, I think, universities in particular to totally return to full life.
There's a number of questions regarding booster shots, and the thought, will there be booster shots? Will they be able to get booster shots at Columbia? What are your all's thoughts on booster shots?
I can start. I think at this point in time, there are no recommendations for booster shots. At this point in time, there's certainly the pharmaceutical companies that make vaccines are producing new versions of their vaccines based on new variants of the viruses and so on, but there is no recommendation to receive booster shots as of now. If a recommendation, if there will be in the future recommendation for booster shots, then certainly the university would provide such booster shots.
And just to add to that, for those of you who've been on campus, sorry, I'm off camera, during flu season, I don't know, it's not letting me turn my camera on. Oh, there we go. For those who've been on campus during flu season, we're pretty good at doing mass vaccination clinics and getting multiple, hundreds of people through in one day. So if there is a recommendation for booster shots, we're pretty scaled up to do that as needed.
There's a question about cost. How much is it going to cost if students come and get the vaccine here at Columbia?
Nothing.
It's zero.
Zero. No dollars.
Great price to me.
Yeah.
And there's also some questions about, will it be easy to get an appointment, kind of what to expect about appointments and availability and access and the student experience.
So this is one of the reasons why we're really requesting documentation now, so we can plan. Right now, actually, we have daily appointments. If you're in the New York area and you want a vaccine, you can make an appointment any day of the week, and we're even accepting walk-ins. Obviously, we'll need to evaluate how many of our students need vaccination as we, get to, I guess, late July, early August. So that's why we're requesting the documentation, and we'll scale up our operations as needs be. So long as we continue to have adequate supply, it should be pretty easy to get an appointment. Right now, there's multiple sites across the city where you can get vaccines, no problem.
Great. There's also conversations about what will the student life be at Columbia during it. There's been a few, and so I'll start. We're super excited that you're coming back, let me tell you. And there will be, I know the schools, I just met with the deans of students today, and they're all talking about how to create particularly community building events and activities that will be in person. It will probably be a hybrid model for many of the schools as students are coming back, but definitely they're talking about the in-person pieces being around community. And the university is actually looking to host new events in recognition of this time of coming back as a community. And so more information will be shared as the months unfold regarding what you can expect regarding your student experience, both inside the classroom, but also outside the classroom as we come back.
Joseph, I would just add, I think we're all really enthusiastic about how do we give opportunities to the students to resume many of the not only classroom activities, but social activities that they experience on campus. I will add one slight cloud over that, which is that we do have to monitor. As you saw, we literally spend a good portion of every day looking at the data. And so the hope that we all have is that COVID is relatively contained, and the numbers that you saw today are the numbers, if not lower, that we see in the fall. But should something else happen, we will readjust because we will have to. We have our own monitoring plan that really requires for us to shut down or shrink some of the activities in concert with what's going on in the community, the immediate community, and certainly in the state. And it's really important that we say that we didn't make a lot of the rules. The rules were made through either CDC guidelines or New York State guidelines. So things like occupancy size and distancing were imposed on not just Columbia, but on universities around the country.
And Joseph, I'll just add also, I mentioned that, we have been looking at space prioritization. And so we will, again, as public health conditions, we'll monitor them closely, but it is our intention across the university and within schools to use the space to support student life and instruction as much as possible. So we will not be hosting visitor conferences that have visitors coming in, because we want to make sure that the spaces that we have here are available as much as possible for our students to come together when it's safe and appropriate to do so.
Thank you. And then there's also, keeping on this, talking about engaging with the city, and I see Wafaa's actually answering it as I talk. so Wafaa, maybe you could just share with the broad group, about engaging with the city. Our mayor has announced that July the city is open, and so museums and theaters and so forth will be opening up in the coming months, and what to expect in that space.
Yeah, I mean, I think I was just going to type in, I've been typing some responses, is that this is really dependent on what the city determines and the state determines in terms of the opening up of restaurants and museums and concerts and so on. So, we'll follow essentially what what the guidance will be at that point in time. But we anticipate if things go well, as Donna was saying, and we continue to go in this, to be in this, with low rates and increasing vaccinations and so on, then hopefully by the fall, there will be open access to a lot of these, of the very activities that make New York such a wonderful place to be a student in.
Great. Well, we're getting close to time, so I'd like to, we'll continue to collect the questions, and these are wonderful questions, and be able to present them out in different ways, either through FAQs and so forth in the future. And there will be future opportunities to engage again as a community as more things come available, and planning continues to further as we move forward. I'd like to, if you could join me, I know they can't hear you, but if we can clap for our panelists for sharing their time and their expertise with us. But I also want to acknowledge beyond that, these are the individuals that have been putting hours and countless hours of work and dedication and care and thought in keeping our community healthy and safe, keeping Columbia open, and keeping our numbers, extraordinarily low during this pandemic. And so I cannot give enough gratitude to all of you for your work, and thank you for sharing all of your perspectives and expertise with us today as we move forward. Clearly it's a rapidly changing situation, and while we'll do our best to make sense of it in, individually, it's important to come together like today's conversation and look at it in a broader context. I also want to thank you, our audience. Like you can tell from all of us, we're very excited to welcome you back to campus when you're able to join us, and to come back together and to learn from each other as we navigate the pandemic together. At University Life, we remain committed to these conversations and to ensuring that as members of the community, you have access to the best and most actionable information possible. As a reminder, we'd love to hear from you at University Life. You can always reach out to us by email, which is universitylife@columbia.edu. You can also follow us on Instagram and Facebook, and send us your thoughts, your questions, your ideas there, and we're happy to engage with you as well. You can also find other events and activities on our website. So again, my gratitude to the panelists and to each of our participants, and we wish you a wonderful, wonderful evening. Thank you.